The CDC says 153 cases of severe lung disease can likely be blamed on vaping. The cases are spread out across the country. A teenager in Texas had to be put on a ventilator, and a 26-year-old in Wisconsin ended up in a coma. Both are recovering, but doctors say they'll likely have permanent lung damage. The only thing in common, all patients said they used vaping products with nicotine or THC in them. Colorado is now one of those states with a vaping-related lung illness. Public health officials said today they found at least one person has been hospitalized on the Front Range, and they're investigating a second case. Reporter Jordan Chavez explains how the health department came to the conclusion they did.
It was sent in big, bold letters. The headline, one confirmed case of sudden and severe illness tied to vaping. It's something the Colorado Department of Public Health and Environment hopes puts people who vape on high alert. But what you should know is what they've actually confirmed.
We have a case definition that the CDC has created, and in order to be called a confirmed case across the country, you have to meet specific criteria.
Dr. Tista Ghosh, the chief medical officer at the health department, says that criteria involves a patient showing certain symptoms like shortness of breath, chest pain, coughing, possibly coughing with blood, and potentially fever. But doctors have also told us these could be symptoms of pneumonia, signs of a blood clot in the lung, or an infection like tuberculosis. And for it to become a confirmed vaping illness, the CDC needs to know if that patient actually vapes.
This particular case has met those criteria, so they are being considered a confirmed case that matches the other cases around the country.
What experts can't confirm is the true source of what's making people sick.
Is it a heavy metal that's contaminating it? Is it a solvent? Is it a pesticide? That's what we don't know yet.
Even without a specific cause, the CDC still considers this a confirmed vaping-related illness, even though they can't definitively prove it started because of this. Jordan Chavez, 9 News.
And Dr. Ghosh says she fears the number of these cases in Colorado could rise. She says the health department sent alerts to health providers warning them to be on the lookout for similar symptoms in patients.